All right. Yeah, this is just gonna be an update. Uh, yeah, this is just gonna be an update on my recent spinal fusion. Uh, yeah, I don't know where to begin. Yeah, everything was perfect. I can't remember everything that I said in the first video that I made. Um, but yeah, I mean, as soon as I woke up, uh, everything was just fine. Like the pain was gone. The first maybe 2 days, I took Tylenol, but yeah, that was fine. Uh, Maybe the first 5 days, a week maybe, I just had to sleep on my side and put a pillow between my legs. Like I was getting a weird pain in one of my hips, like the joint. But other than that, every day since then has been great. I never took any pain medication in the hospital. I never took anything at home. Yeah. So they also gave me, who's this? They also gave me a back brace that I never had to use. I used it on the first car ride just because I wasn't sure. But no, since then, haven't had to use it. I think it's like a low frequency bone stimulation thing. Looks kind of like a brace that I do for 30 minutes every day. But yeah, I mean, I've been trying to go on walks when I can, not pushing it too hard, maybe like a mile, just to, build up some endurance again. My incisions healed up fine. The steri strips came off after maybe a week, and there was one spot that opened up a little bit, so I just kept changing the tape and put a piece of tape on it until it, healed back up. And yeah, that's fine. So yesterday was, I think, 3 weeks to the day. Yeah, and since then, I mean, like I said, everything has been fine. I'm going on walks. Here, let me switch this around. So I've been coming here a lot. This is the riverfront in Wilmington, Delaware. This is like a kind of sanctuary place up here. Yeah, probably better to look at this than look at me. Goes all the way kind of down there. But yeah, so what changed? So I still use the zero gravity chair. I'm just gonna go up here and turn around. But I still use the zero gravity chair just because it doesn't put as much strain on where my incisions are. The skin is still a little bit swollen, and I just don't want to really press on it too much. But yeah, but sleeping's fine. Before, every time if I was about to sneeze, I would panic. Like, excuse me. I would panic before I sneezed, like when I felt it coming. Yeah, it's a nice day today. Yeah, let's go back. But if I had to sneeze or if I had to cough, yeah, I would panic right before. Now the pain, it's totally gone. Before I could barely bend over without it hurting. Now I can bend down and almost touch my toes. It's completely gone. Yeah, if you're having any similar issues, like if you have a herniated disc, I can't recommend enough to have it looked at. I mean, don't put it off as long as I did, because for me, the relief was instant. So, yeah, there's a lot of people. This path actually goes almost 10 miles to Battery Park in Old Newcastle. But, yeah, I'm not to that point where I'm going to walk 10 miles yet. So there's Wilmington. Has its nice areas. Yeah. What else can I say about my surgery? I had a follow-up. I guess that was maybe a week ago, maybe a little bit longer. And, you know, they just checked the incisions and all of that, and then they scheduled another follow-up for 6 weeks after that appointment. And then at that point, they'll probably send me to PT. The doctor, she seemed to think that I was probably going to be out from that point about 4 months before I go back to work. So the month, or a little bit more than a month, for the follow-up appointment, and then 3 months of PT. So yeah, it looks like, I guess, December. Yeah, so about December that I'll go back. Yeah, it's crazy because I went out in the beginning of April. So, you know, I've been dealing with this as far as from being out of work for almost a year. Crazy. Let's see what's down here. Yeah, I haven't been down here before. It's kind of cool. Yeah, just kind of exploring, you know, just trying to do a little bit more every day, just to mainly build back my stamina. I don't know if you can tell, I'm already a little bit winded just from, I don't know, walking 10 minutes. But, you know, I haven't done much now for, I don't know, 6 months, 5 months maybe. So, yeah. But yeah, as far as my surgery, I'm basically back to normal, other than stamina. I still don't lift anything heavy, just because the doctor wants to make sure the cage and the screws and, you know, everything actually fuses, and I don't want to have to go back for them to do any repairs. So it's probably wise to not lift anything. Yeah, I know I'm kind of rambling at this point. I just don't really have too much more to say, because everything from the moment I woke up was good. You know, I mean, the first week, I guess I was a little bit sore, and like I said, I took Tylenol a couple days, but no, since then, I mean, I'm out doing everything, well, almost everything that I normally do with no pain. Yeah. So anyway, I'm probably gonna stop this video here. I don't really know how to edit anything, but if I can figure it out, I'll add pictures of my incisions from the beginning and kind of how it's healing now. So yeah, if you see those, then I figured it out. If not, maybe in another follow-up video, I'll show that. So I'll probably mark this as like a 1 month update, even though it's been, I don't know, 3.5 weeks, but close enough. All right, thanks for watching.